Hi, good evening, and welcome to this training. We'll be talking about um, the fundamentals of research paradigm, and that's what we'll be discussing about today. Fundamentals of research paradigm and introduction to systematic reviews. So, my name is David Chinecham Innocent, so I'm going to be your facilitator today. So, we're looking up to a very, very successful and enriching meeting. So don't worry if you're not new to systematic review, you're going to get all the necessary information that is required for you to mm, jump into action. And also, if it happens to be that this is you're looking for probably you want to publish your manuscript or you're a PhD student, and this is an opportunity for you to um, get the rudiments or or the rudimentary understanding that is very imperative for you in this field of systematic review. So before starting this session, I'm going to let us know that these are the training is going to cover a lot of aspects. It's going to cover the formulation of research question. By the time we've understood the paradigm, how to shape our thoughts and understanding, and also it's going to expose us to the necessary information that we need to know for conducting a systematic review. Now, now that is by the way. Now, this is our outline for today. So the outline the we'll be using to dish out this information has already been laid out. The first thing we need to understand is we're going to be dealing with I'm going to explain what systematic review is all about. Then I'm also going to explain the hierarchy of evidence. I'm also going to explain the importance of the systematic review. Then we'll go ahead to differentiate between the systematic review and the usual traditional literature review that you've got. Then we'll now introduce us beautifully to what we call the research paradigm. Then we also understand the major research paradigm, the relationship between research paradigm and methodology. And then fantastically, we're going to get examples of diverse systematic review research questions and their paradigms and also practice questions. So we are good to go. Now, before we commence this session, we really need to make it very clear to each and every one of us that so we have a baby here, right? So that this baby here, it lets us know that systematic review is going to be explained as simple as to a 5-year-old baby. So it means that it doesn't matter where you come from, it doesn't matter your status quo, be you a PhD student or a clinician or maybe a social care worker, you're trying to integrate yourself into practice or you need evidence to inform your right now approach, then that means this is the right place for you to be, and this is the right training and the right step for you to take ahead of this training. So let's get into the class. Now, can you imagine? Imagine a young boy, a 6-year-old child who is carrying a big bag that contains, about 10, or a box, a kind of box, that contains 100 balls. What do you expect inside of the bag, right? So before the 6-year-old actually has that, big box that contains those balls. So for you to call it a big bag of ball, it means you need to do what? Pick up all those balls from diverse places, right? Then place it into that box. Then you can now call it what? A big bag of box, or you can call it a big box, whatever thing you want to call it. Now, what are we trying to say? A systematic review is just all about collating several studies, several individual studies. They can be in form of primary research, they can even be in form of systematic review itself, right? Because we've had evidence of systematic review of systematic reviews. But that's by the way now. Now, a systematic review fundamentally is explained as, the process, by which we collect individual studies, right? So let's say, for example, you want to look at prevalence of HIV and AIDS in Nigeria, right? So that's a big research question. So are you going to go about to several places in Nigeria, texting people, using maybe a certain kit to go to all the, that's go around the population, the very big population, vast population of individuals in the country, to go and test them, then to come up with your overall evidence of prevalence of HIV? That's going to be really, really, really time constraint, time constraining, and it's going to really come with a lot of funds, right? So the best approach to address this problem is by using what we call the systematic review approach. So what does the systematic review do is that systematic review is more like a desk-based research. Most times you have to sit down at home, you work with your team, right? Then collect the individual primary studies that has been done at various places, collect them together, then summarize it and use it to form a what? An overall conclusion. So this is very, very simple here. So when we define, we say systematic review is a type of research that collects and analyzes multiple studies on a specific topic to find overall trends and draw conclusions using a structured and methodical approach. So it's just very simple. So what we need to understand is that for us to do a systematic review, right, there needs to be something we need to follow. Let's say a 5-year-old baby, a 6-year-old or 5-year-old baby can be able to do what? A systematic review. It's very, very possible. So if you have a child, maybe let's say you're currently breastfeeding, so it's very possible for you to teach us baby how to do a systematic review. The only thing you need to do is to do what? Get the baby a checklist, ask the baby to follow the checklist, teach the baby how to follow the checklist, and the baby will be able to do what? Gather the what? The evidence. So I've actually thought about, I've talked to some certain PhD students, and I told them that, with the advancement of information and knowledge, right? So you can actually ask a dog, prompt a dog to do what you want the dog to do. And that way the dog can be able to do what? Gather numerous papers, and you find yourself doing what? Collating an overall what? Evidence. So let's say you want to do prevalence of malaria, burden of malaria in Africa. So for the sake of this session, right, we're going to deal with one certain what? Systematic review question. We're just going, not just a systematic review, one research question, which is going to be what? Burden of malaria in Africa. So that's going to be our focus in explaining. So what it's all about is, right, well, so you need to go through several countries in Africa and pick up primary research, summarize it, then you have the burden of malaria in Africa. So while we move on, it's going to be simple. Trust me, we're going to make it very easy for each and every one of you. And trust, and I just want you to believe that one, you don't have to worry yourself. We have all the practice, guide practicals put out there to help you in further session. All right. Good, beautiful. Now, one may ask, why systematic review? Is systematic review now better than the cross-sectional study that I did? Is systematic review better than what my doctor is saying about malaria? Right? Is systematic review better than the case control study that we did in my PhD, or that we did when I was an undergraduate, or that we did, as a field work? Is systematic review better than the randomized control trial that we went to, to test, a certain intervention or drug? The answer is actually that a systematic review and a meta-analysis is at the top of the pyramid. And that is why we have what we call the hierarchy of evidence. So hierarchy of evidence tries to explain that from the bottom to the top, right, we have the level at which the findings of a study can be really, really accepted. So it means that evidence from the editorials, right, and your experts, your doctor, is of less quality compared to findings from a case series. So findings from a case control is greater than that of the case series and case reports and editorial. Now, findings from a cohort study is more rigorous compared to case control, case series, and editorial and expert opinion. So finding from a randomized control trial is more rigorous and evidence-based compared to the ones at the bottom. And now a systematic review is at the top. So for example, let's say a systematic review on the effects of contraceptives among adolescent girls in West Africa, right? Now, the finding from that systematic review is what WHO is going to use to make a publication on what teenage girls should do. Now, let's say, for example, also, we all agree that paracetamol is used to prevent, is used to reduce or manage symptoms of what? Of headache. Now, that particular, for WHO to publish paracetamol or metronidazole or whatever drug, class of drug, as the most effective drug in managing symptoms of headache, it is gotten from evidence of a randomized control trial or a systematic review. So it is as a result of a systematic review that was conducted by comparing maybe, because from randomized control trial down to here are all primary studies. So the systematic review evidence that informs that paracetamol is effective in reducing symptoms of headache comes from summarized primary articles from what? Randomized control trial. So it means that when we combine several primary research, maybe a randomized control trial cohorts, join them together into a systematic review, right? Which we are going to explain anyway. We get a more quality evidence. So it is as a result of your finding, right, from your systematic review, that is where WHO is going to do what? Make an informed what? Evidence. That is where WHO is going to inform clinical practice. That is where WHO is going to inform that what? That is where WHO is going to inform, or other policymakers or other healthcare professionals are going to use in making decisions. Let's say you're a clinician here, or you find yourself to be a doctor, and you have a patient who is suffering from depression, right? Now, the ability for you to use cognitive behavioral therapy as a method of intervention, or maybe let's say a class B drug for antidepressants for the patient, which one is going to be on the first line treatment pathway? It is based on what? Systematic review evidence. So when we summarize primary studies, cohort studies, case controls, join them together, like we use the word pool, we pool them together, right? So our overall effect is what a systematic review is going to be. So it's that based on that systematic review that we'll know if cognitive behavioral therapy or antidepressants is going to be effective in reducing what? The symptoms of what? Depression. So this is just it. So don't worry, we're going to explain in details what you need to get from a systematic review. So yeah, we move forward to answering what are the importance of a systematic review. So it's very simple. We talked about providing high quality evidence. So we already agree that a systematic review is going to provide that relevant, robust evidence that we need, right? So if a very quality evidence, like determining which particular drug, class of drug, is going to come first in managing a certain disorder among patients, is as a result of systematic review results that we are going to use. So systematic reviews will help to provide the ones which is more effective. So you see, you find out that you need to be doing systematic reviews. You really need to have a lot of research questions out there that you need to be doing what? To be working on. Exactly. So systematic review is very important. It's very, very, very relevant for your what? For your consumption. And it's really, really going to give you a fast majority of what you really want, particularly whether you're a PhD student or a clinician or whatever. So also it helps in identification of gaps. So let's say you're here and your supervisor is asking you that I want you to work on antidepressants, or I want you to focus your research on, let's say, on HIV, or I want you to work on antiretroviral therapy, I want you to work on type 2 diabetes, right? So the first thing you need to do is to do what? Before you conduct, before you start looking for your topic, you need to do what? Use systematic reviews to identify gaps, to know what has been done and what needs to be done. So here now, it also highlights where research is needed, where more research is needed, right? So the idea of the systematic review is that the more we continue to publish, the more gaps are opening up, right? So it's very, very important for us to do what? To identify gaps in literature, because once there is a gap in literature is just what has not been done. That is what research gaps means. And we are going to also give a detailed practical steps in gap identification in along the course of our training. Then also another example of systematic review is that of the importance of systematic review is that it reduces bias, right? So a systematic review clearly reduces what? Bias. So considering that in a systematic review, unlike a traditional review, right, we have to screen the articles that we are including. Let's say we are including prevalence of malaria. We are conducting a study on prevalence of malaria in Nigeria, right? So we have 10 papers from Lagos, we have 5 papers from Imo State, we have 5 papers from Ondo State, we have 2 papers from Kanu, we have 1 paper from Jos, we have 6 from Makodi, 10 from Meduguri and all that, right? So we're not just going to include each and every one of them, right? So we need to screen them for quality. We need to check if they actually meet with the what? With the criteria for our selection. So it means that at the end of the day, whichever finding that we have, when we are trying to say that paracetamol is effective, it means that we have actually screened all the most relevant studies to come up with the fact that paracetamol is effective in reducing what? Symptoms of headache. So that is how it reduces bias because of the transparent process. And again, it's very, very clear because we have a checklist that we are going to follow. So we're also going to come to that. And also it supports evidence-based practice, which I already talked about, because policymakers are going to use the conclusion from your systematic review to make policies that you people should take, maybe stop taking class B drugs, stop smoking, stop, a lot of things, or stop gambling and all that things. All these things are evidence from what? The systematic review. Now, so we're going to look at this aspect of the tools that are used in conducting a systematic review, right? So beautiful. We have diverse tools that we use in conducting systematic reviews. So it's just very simple, right? Before we conduct a systematic review, right? Being a systematic review, it means that there is a tool for us to follow. Now we're going to show example here. We're not just going to talk about the theory. So I'm going to highlight this, right? Go right click. So I'm going to open here. I'm going to paste it, the Prisma checklist, right? So this is it. So I'm going to open it. So I'm going to open in PDF, okay? So let me open. Okay, I just downloaded it. All right, good. So this is what we call the Prisma checklist, right? So now, what is the idea behind this? It means that what? Remember that we are talking about the what? The tools in conducting a systematic review. Now we have a lot of other checklists that we use in conducting systematic reviews. Don't worry, we'll talk about all these tools in our future sessions, right? Now, but the most important tools that we use in reporting our systematic review methodology is what we call the what? The PRISMA checklist, right? So the PRISMA checklist, it has 27 items. So it means for you to conduct this systematic review, all you need to do is just to do what? Is to report based on this checklist, based on this what? Checklist. So it's already established, right? It was established. It was established, I think, yeah, it was established sometime in 2009 with updates and all that. So a system, not that they check this checklist. So we have had diverse checklists before now, right? So why is it a systematic review? So it means that for me to conduct a systematic review, it means that I have a checklist to follow, right? So I just have to clearly follow that checklist, follow that what? Checklist, and that's it. So it means if I want to work on whichever topic, I follow the PRISMA checklist. So the PRISMA means what? Preferred reporting items for systematic reviews and meta-analysis. That is what it means. So this is one of the tools, right? So we move ahead. Now, we'll talk about the differences between a systematic review and a traditional literature review. Now, here's an example. Let's say you're here and you're an undergraduate student or you're a PhD student. Now, let's give, for example, your lecturer, your tutor, or whoever that is teaching you. Let's say might give you a topic, right? Your traditional literature review usually comes in your chapter 2. Let's say malaria reporting in Africa, right? So we're going to look at this question from two different what? Dimensions. Now let's say you have your what? Literature review, which is usually in your what? Chapter 2. So that particular literature review that you write in your chapter 2 is what we call the what? Traditional literature review. Now let's look at this from this angle. In your chapter 2, you start by doing what? Now, usually this is your topic, right? So one thing that is synonymous to your traditional literature review is that what? Okay, let's place this at the top. Let's place it at the top here and color it yellow. Right? Good. So you might start with your 2.1. So maybe you might try to start by introduction to explain what this chapter will entail, right? Then your 2.2, you make that decision yourself. You might say you want to start by epidemiology of malaria, right? Now your 2.3, you might say symptoms of malaria. Your 2.4, you might say risk factors of malaria. Now your 2.5, you might say challenges of malaria in Africa. Maybe in 2.6, you say what? Conclusion of literature review. Now, what do you notice? One common thing you notice is that what? All your headings are based on your judgment. All the headings here are based on your judgment. Now let's assume that this same topic, let's say this same topic was given to you and you are in Ghana University, right? Now we want to understand the clear difference between a systematic review and a traditional literature review. Let's say somebody else in Jigawa State University was still given the same topic, malaria in Africa. right? Now, and this is your PhD, or maybe it happens to be your, maybe let's say it's whatever, it's your MSc dissertation thesis, whatever, right? So now when you come to your tradition, when you come to your literature review, what do you do? Maybe you might try to start by saying concept of malaria. 2.2, you have um distribution of malaria. 2.3, malaria prevention strategies in Africa. 2 point. So now, what is the idea now is that all your headings are based on your own judgment, right? So if you still give another student, another person, this same topic, the person might start 2.1 by maybe definition of malaria. So you see that the judgment of your, so everybody's right. Everybody's right. The same person working on this, right, compared to the same person working with this and the same person working with this are all correct. But then it is based on their own what? Judgment. So it's subject to bias. So you see that this person is going to have different papers. He's going to have his or her own search strategy. He's going to review papers. Maybe this person might get papers from Google, maybe from Google Scholar, a lot of low tier quality papers, right? Why this person might get his or her papers from PubMed, which is another database. We're going to also explain that. Don't worry if you don't understand what this means. We're also going to explain it in details in our subsequent meeting. And then this other person might take papers from Scopus, right, and Scimago. So the idea here is that what, in a traditional literature review, it summarizes selected studies to provide an overview of a topic, right? So it's just based on the papers you select. Whereas in a systematic review here, I happen to be following a checklist. And immediately I state my inclusion criteria for my papers. It is very, very likely that even if that same topic is assigned to 10 people in different schools, we might likely get the same papers, included studies. So that is why we say that what a systematic review is what reproducible. It's something that once the reviewer, that is why most times here with the major challenge we have is, we find people find it very difficult to publish their papers. Might be that maybe their traditional literature review, maybe your literature review or your seminar work or whatever type of literature review that you want to publish, right? The reviewer is after how do you think that you are right with what you're saying, right? So you've just reviewed your own papers. How much knowledge do you know? So it's usually very difficult for early career researchers, right? Or you just started your PhD and you want to publish a traditional literature review. You want to publish your literature review in your MSc thesis. It's usually very difficult because they know that you are an early career researcher, right? They know that you're not yet an expert. So it takes the knowledge of the peer reviewers to know the people who are publishing, because they understand that, yeah, okay, this person has a lot of, this person has a lot of experience, right? So that is why they might want to choose this person over this other person compared to what a systematic review. So it is more easier for your baby, for a 10-year-old baby, to publish a systematic review than an early career PhD student who is trying to force a traditional literature review. So once the baby follows the checklist, follows the methodology that is provided, follows the search strategy, follows that checklist, performs the quality assessment, which we are going to explain in the future, and it's very transparent. So this is the difference, right? So in your traditional literature review, you're making the judgment. You're the one to decide to put this heading. You're the one to decide to put any type of paper you want to put. You're the one to decide. Everything is based on your own decision. So it's subjective to bias. And again, you know that systematic review is usually conducted by multiple persons, right? So these are other differences compared to traditional literature review where you're the only one that is conducting it, and it's more likely for you to do what? To make wrong judgments in your selection of what? Studies. So I really, really want to encourage you guys, right? Yeah. So I have over, you know, 10 systematic review publications and lots of publications, over 45 publications. You know, research, you can look up my research gate, you know, we had a lot of acceptance, you know, recent acceptance for diverse journals and publications. And all these are going to be possible by what? Constant practice. And trust me, the future part of this lesson is really, really going to make a lot of sense. We've put out practical sessions, you know, in subsequent days of this training to make sure that each and every one of us gets to where they want to be. Trust me, systematic review is very easy. It's more easier to conduct than the primary research, provided that you follow what the outline, you follow the given tool, and we are going to explain that too in details in our future what session. So all these items are going to be captured. We're going to explain these 27 items and make sure each and every one of us is on track. And you can actually get acceptance, publish thousands of manuscripts as possible, you know, give yourself that, you know, that particular heads up that you really need for your PhD in your studies. All right, so this is a 4-year-old baby, I'll be 4-month-old baby that she's really passionate. She wants to introduce us to the major core aspect of this training, which is research paradigm. So I'm sure we are very much ready to understand what research paradigm means. Now, one problem we have, you know, is that most times, you know, as students or as early career researchers or as practitioners or social care workers, we start our methodology without telling us or without telling the reader, or let's say you're writing your PhD dissertation, right? So you've gotten your topic and you've just gotten acceptance and you want to write your PhD thesis maybe on, you're trying to look at cancer as a whole, very broad topic. Or let's say you want to look at prevalence of cancer in Nigeria or in Africa, right? Now, the very first thing we need to know before when we shape our research question is to understand where we are standing on. So, in a jiffy, what research paradigm is defined as is what? It just defines as the set of beliefs. What do you believe? How do you view truth before you start your review? So it's just very simple as this baby, right? So what this baby is asking you now is what? She's asking, where are you standing on before you start your research? What type of research question do you have? Do you have a qualitative research question? Do you have a quantitative research question? Or do you have a mixed method research question? So it is just connected to the fact that we have what? We can have a quantitative systematic review, a mixed method systematic review, and a qualitative systematic review. So this is just what research paradigm is all about, right? So what you're trying to understand is what we want to know where we are standing on. We want to know our position on the paradigm. We want to understand our paradigm. So by paradigm now we mean what? Our belief. So let's dive into it. Don't worry, you're going to get a lot of questions, a lot of samples. We're going to also see a lot of samples and, you know, practice exercise that will really get us into this. Thank you. So theory again. So by research paradigm are basic belief system or worldviews that guide researchers on how to understand our study our reality. So more like, just like I said, you know, it just provides the framework for us to understand how to collect and interpret data. So we're going to explain this now in a layman's form to make sure each and every one of us is what understands it. So another very important thing before we move on there is that research paradigm determines, like I said, it determines whether your research is going to be qualitative. So you can imagine, let's say you're in a discussion with your friend. Let's say your friend's name is Bola, and you're like, "Hi, Miss Bola. Miss Bola, this is the fact. This is the fact What is fact? Research. Okay, you research, you've conducted research, right? And you say this is the fact, and it is based on statistics that 90% of our girls dress decently. Now, what is the paradigm of thought? Is based on a what? Quantitative position. And we have three core paradigms, which I'm going to explain in the next slide. We have the positivism, interpretivism, and critical what? Realism. We also have diverse ones. Now, the point now is that what? When your friend says, "Hi, Bola," I'm telling you that 65% of men are not cheaters. Men don't cheat. How? What is your fact? Because of what? Statistics provides that what 45% of men don't cheat. It means that your research paradigm, her research paradigm to find out that particular information is clearly based on what? Positivism. So what's positivism? Positivism is just all about what? It tries to use what? Statistical approach to summarize what? Reality. So we're going to explain this in details with real life research questions so that at the end of the day we are all well satisfied with this. Now, contrarily, she can actually say, based on experience, men don't cheat. Experience is rooted from what? Qualitative, right? So that means her research paradigm to find out that men don't cheat is based on what? Interpretivism. Now, if she says based on my experience and based on the numbers, statistical numbers, men in Africa are found not to be cheaters. They don't cheat. So that is based on what? Critical realism. So critical realism is more like what? A mixed method approach. When you're trying to use a mixed method approach to make your judgment, right? About maybe certain social factors, right? So that is really rooted at what? Critical what? Realism. So let's say you started your PhD, that's the most important part of it. And you want to write your methodology. Before you start, most of us just start writing our research design. No, Bishop, the very first thing you need to put down in your methodology, let's say you want to start writing your methodology now for your PhD thesis, right? Is your what? Let's say you've come to your methodology, right? Methodology. Now, be it a systematic review methodology or whatever. Let's say in your 3.1, you might start to say, what is your design? What is your 3.2? You start talking about maybe the study setting. Let's say, for example, if you're doing a primary research that requires you to maybe go out to collect questionnaires or go out to conduct interviews or go out to use both interviews and maybe questionnaires as a mixed method approach. So it means that rather than starting with your design, you need to start by what we call what? Your paradigm. You need to tell us your paradigm. How are you going to approach this question? So it is possible that two people can do prevalence of HIV slash AIDS in Africa. One person can use a positivist approach, also meaning that what it's going to be a quantitative, systematic review. For example, let's say this is a what? Let's say this is a what? A systematic review, right? Let's say one person can use what? A positivist approach. When we're talking about prevalence, we are talking about numbers. Another person can decide to say, okay, let me use the what? A mixed method approach, which is what? Critical theory. So this is just an example of what we usually do. So, right? So in your paradigm, what you need to talk about is your what? You need to talk about what position are you going to stand? What is going to be the basis of your methodology? What is going to be the basis of your ontology and your epistemology? So we're going to explain that in subsequent slides. So let's take an example of what positivism might seem to be, right? So let's assume, imagine you have a magnifying glass and you want to see, now let's look at this fine 10-year-old boy or maybe 8-year-old boy. So let's say, imagine you want to, you have the magnifying glass, right? So this is just for a baby to understand what positivism means and know how to shape the research paradigm. So positivism is like using the magnifying glass to look at things closely and count them. So just like we said, positivism equals to what? Quantitative research. And it equals to what? Counting. So let's say you're doing a questionnaire study that requires you to, measure people, measure numbers, measure whatever it wants to be, right? So positivism is clearly what? Related to what? Counting. It's really related to counting. Positivism is related to questionnaires, surveys, experiments, any type of quantitative study that you're doing. You must first of all tell us, where are you standing on? How have you shaped your thoughts? In short, as a matter of fact, um, most tutorials out there, you hardly get information on research paradigms. Most people just start discussing the methodology, but what we are doing in this session is to break it down bit by bit to make sure that you do what? You understand all the rudimentary areas of what? Of your research. So look at this boy here. So it's about finding out the fact that everyone can see and agree. So at the end of the day, now what he can tell his friend is that what? That based on my facts, I counted that there are 30 balls in that particular chessboard. So that is positivism. It's based on numbers. He saw it. Remember that what we call positivism is based on belief, a paradigm. What do we believe? We believe in facts, numbers, right? He can see it. Ontology means his ontology, this boy's ontology is based on the fact that what he can see, what is reality to him is what? Reality is objective, right? It means that he can see the ball. The way he draws his knowledge, drawing of knowledge to him now means epistemology. It is based on what he has counted. So two things are happening to this boy here: his ontology and his epistemology. His ontology is what he's seeing. He can see it, it's real, right? And his epistemology is counting. How he's drawing his knowledge is based on what? Counting. Now, for interpretivism, beautiful. So think about when you were small, right? So your parents are telling you stories. Let's say, for example, during the civil war or the Rwandan genocide, or some certain things that have actually happened in history, right? Or during the assassination of the first American president or whatever, right? So when you're asked to conduct a systematic review of all the reports, remember that a systematic review guides us, helps us to have a clear picture. A systematic review is usually needed when there is conflict. Let's say this person is saying 30%, this person is saying 50%, this person is saying 70%, this person is saying 80%. So when we need a systematic review now to summarize all the evidence to have one singular word judgment, so that we can say that based on everything, it shows that what 85% is this. Now, that is the case. Now, in the case of interpretivism as your paradigm, right? It is possible for you now to think about a stories you've heard, a lot of things, a lot of persons here, they only learn their lesson through what? Experience. They don't believe in facts or numbers. They learn lessons through experience. So interpretivism is just all about, it's just solely all about the fact that what? That you build your, if you build information, you build the basis of your ontology, how you view. Now remember, the ontology of interpretivism is what? Is subjective. It's something you cannot see, right? And now the epistemology, how you build knowledge, is based on what? Experience. So interpretivism as a paradigm is based on what? Experience. That is how we shape our understanding. So if your interpretivism equals to what? Qualitative research, pure, it equals to what? So think about the children that are surrounding this woman, this old woman. So at the end of the day now, they get to hear stories from her, and that is what they use in making their judgment. Based on their ontology, they can't see it, it's subjective, it's inside them. Remember that ontology is all about how you view reality. So they can't see it, it's subjective. And based on their epistemology means study of knowledge, is based on what? Their experience. It's just based on the experience from others. That is how they gain what knowledge. So there are so many people. So it's also a very nice approach to research. What you need to do in your methodology is always to do or to justify whichever approach. So if your research question is a qualitative research question, so you need to align it. You need to explain interpretivism. Explain that is the approach that is best suited for your question, and that is the reason why you need to use it, because it is what best suited and it is based on experience and because of the nature of the question. So this is just all it is. So at the end of the day, when they are done listening to these stories, they have more stories to do or to tell. So this is fantastic for a what for an infant to understand. So critical realism, very simple, very easy, very nice, very easy to understand. It's just a combination of two of them. So when you look at this boy who is holding this ball, right? So he's counting the ball and also listening to stories from the background. So it's more like imagine. So if you look at this slide, so imagine you and your friends are playing a game, but some of your friends are not having fun because the rules are not fair, right? So first, you use a magnifying glass to count how many times each friend gets to play. So this is just like using these numbers to understand the problem, right? Which is positivism now. Then you listen to each friend's story, interpretivism, about why they are not having fun. So this is like listening to their feelings and experiences. So remember that we said that critical theory is what a mixed method. So don't worry, by the end of this session, right, we are going to see examples of real life research questions. Then we can be able to now tick and understand which one goes for which one and how a mixed method, how you can see a research question and understand that it's either going to be a mixed method, which is critical realism, or or it's going to be an interpretivism, which is based on qualitative, or it's going to be a positivist research question, which is based on what quantitative. So now at the end of the day, finally, you put both the numbers and the stories together to change the rules so everyone can have fun. So this is like a mixed method approach where you use both counting and stories to make it better. So this is very simple. So this is just for a baby, somebody who is just new to research, to understand that we have three core paradigms, and it's a very, very fundamental aspect for our methodology. So by tomorrow, by in our next session, in our next video, which you're going to find the link below, right? So in our next video, you're going to understand the how to formulate a research question from the very basic scratch. Let's say you're a baby and you don't even know, you don't even understand anything about research, right? So we're going to explain it to the very, very lowest minimum possible so that you can be able to do what? Understand how to formulate your research question from the basics, and that way you can know where you're standing on, you can know where the paradigm of your thoughts for your research question is, and that's it's going to do what? Help you. So beautiful, beautiful, fantastic. So now we need to understand the intersection between what? Research paradigms and methodology. So I've just literally explained this. Positivism is quantitative, interpretivism is qualitative, critical theory or realism is one mixed method. So this is just what I explained based on the ontology. Ontology is all about how do you view it? How do you view it? Why did you view it? So remember that it is single reality. So it's an objective reality. So it's based on what you can see. You can really see it. It's based on the facts. These numbers are there. Right? So how do you draw knowledge? Is by measuring. So it's something that that can be measured. So when you look at some type of research like surveys can be a cross-sectional research where you use your questionnaire to measure participants' knowledge, you use your questionnaire to measure participants' perception, measure their level of practice, measure blood pressure, measure test between two drugs. When maybe let's say you want to test between an intervention and another intervention, that's an example of what? An experiment. So it's quantitative. Your evidence is going to be based on numbers. So when you remove numbers, you're handicapped. So the only way you can make your judgment from a positivist standpoint is based on what? Statistical analysis, right? So it's all about numbers. It's all about numerical strength. It's all about anything that deals with what? Statistical data and numbers. Now, for interpretivism, your reality is subjective, right? So what do you mean by the ontology? The ontology being subjective means is that how do you view the truth? What is the reality to you? It's based on something you're being told. Compared to this one for positivism, you can see it, right? It's factual. But here now it's based on something you're being told. And how do you draw your knowledge for interpretivism? It's based on what? Experience. Epistemology is a Greek word. The Greek word epis means knowledge. Knowledge. So this is study of knowledge. So if you can look it up now, epistemology, what's the meaning of epistemology? Epistemology means study of knowledge. So how do you gain knowledge for interpretivism? Is based on what? It's based on people's experience. And the approach is what? Qualitative, so which we've already linked. So if you have a research question that is qualitative, it means your paradigm is what? Interpretivism. So you're just going to explain the ontology and the epistemology. That's all. They're going to explain that based on this, the reality is subjective. You feel like this question is going to be this, that, and that, and then you make all your arguments. So it's very simple here. What are examples of qualitative research? So we have a lot of them. Like we have narrative design, we have interviews, any type of research that uses interviews, right? So more like in qualitative research, we're trying to understand people's perception, people's opinion, people's perspective, people's experience, right? Well, how do people perceive things? That is what we can use. We can either use a focus group discussion, sit them together, and record. Then at the end of the day, transcribe it, do what we call in vivo or thematic analysis, right? All these things are for what? Any type of research question that tries to understand why do girls use contraceptives? Why do men cheat? Why do men do this? So with that type of research question, you need to do what? Conduct an interview, right? If you use a positivist approach to address a question that requires a qualitative decision, it's going to pose a lot of limitation, because if you imagine giving somebody a questionnaire for as a quantitative study and you're asking the person why do men cheat, he will just put everything he feels like ticking, and you might get the wrong data in your quantitative decision. But rather, why do men cheat, for example, right? Or why is infidelity at its, or why is there financial crisis among business startups, and you gather business personnel, right? So it means that an interview will allow you to get in-depth information from them. So that is the approach here, right? So they will tell you based on their experience. That's how you're going to draw the knowledge from them, and it's going to be subjective, right? So at the end of the day, you've gotten the information. You can't really. It's not something that can be hold. It's not something you can hold. Like it's something you can view, right? It's just based on subject. It's entering into you, right? And whereas here, at the end of the day, you're carrying the data around, and here you can measure, you can count the question, you can measure it. That's how you get the knowledge. At the end of the day, you summarize. So I hope this is very clear in the sense that even an infant can be able to say, oh, mama, mommy, I think that question you're asking me is from an interpretivist position. You say, no, my child, I want you to tell me why you came late for school. It's for interpretivism. I want to know how much time do you come early, or do you come back early from school? That is what positivism. So critical theory is very simple here. It's just a combination of what both approach. So here we're trying to combine both positivism and interpretivism as critical realism, which is a mixed method approach. So here you can actually find case studies, participatory research, can find surveys, combining surveys with interviews. So that is just right all we needed then. So yeah. So let's get to examples. So we have our baby. She wants to teach us to what a very beautiful baby, right? Yeah. So she wants us to get to examples and not just look at a lot of questions there. But let us see real life questions on these paradigms. Okay, so she has released us. So now let's say real questions for positivism. Now let's give an example. This question is, what is the impact of new medication on the blood pressure levels of patients. Now this is a what? This question now, look at the explanation why it is a positivist question. And this question seeks measurable objective data on the effect of medication. So here now, impact is measurable. So impact is not something you need to determine with an interview. You can ascertain impact by using what? A focus group discussion. Remember here, these are more of the methods, right? So it means that what is measurable is objective data. Here we might use a measuring tape, we might use maybe before to after study. It can be a cohort study, cohort design. A cohort study is also a type of what? A quantitative what? Design. So we can use a cohort approach to address this question. And at the end of the day, right? So we measure the data and we can determine the impact. So the number is going to be statistical. Consider the impact is based on 2.50. That's it has 25% impact on men. It has 90% improvement impact on women and all that. So that is the idea. Statistics, number is what? Positivism. Now, look at this question. How does the rate of hospital-acquired infection change with the implementation of the new sanitation? Now, this question now focuses on quantifying change in infection rates. So these things are all statistical variables. All these things are numerical. So anything numerical is quantitative. Any research question that contains numerical variable that is rooted, not just containing now, because it can contain numerical variable, but the variable that is rooting it is what? Is qualitative. But however, if it contains a total numeric variable, right? Rate of this. So this is going to, at the end of the day, we might be getting 37%. That's the rate, right? In our overall conclusion. So it is clearly what? A quantitative methodology. So which is going to be what? Positivism. Now let's look at other examples for our last example for positivism. Now look at this. Another question on relationship. A question on relationship is also what? Is also rooted for what? Positivism. Here we are looking at what is the relationship between daily physical activity levels and the incidence of type 2 diabetes among adults. So this question now aims to statistically analyze the correlation between physical activity and so this is just numbers, right? So correlational questions are what? Oh, remember that I said correlational questions are what? Numerical variables. So moving on to the interpretivist paradigm, now let's look at some of the type of research questions that we can now find out that, oh, that these questions are for interpretivism. And let's say, how do patients with chronic pain describe their experiences with healthcare providers? Now, for you to ascertain their experience, you need to sit them down and interview them. You need to engage them either in an ethnography or in a focus group discussion. So this question explores personal experiences and subjective meaning. So then at the end of the day, you find them talking about in-depth, giving an in-depth information about their experience. And that is clearly what interpretivism, which is qualitative. Also, what are perceived barriers in assessing mental health services among adolescents? So this question tries to understand individual perspective and experience, which is the same thing I just explained. And it's clearly what? Qualitative. So further questions there is, one thing that is synonymous with qualitative studies is what? Experiences, which is mostly the epistemology. How do you study the knowledge? Is usually what? Experiences. So how do caregivers of patients with Alzheimer's disease experience and cope with their caregiving responsibility? So this is what? Pure what? Interpretivism. So yeah. So moving on to critical theory / realism. So this is more like a combination of what? Positivism and what? Interpretivism. So here we say, how do socio-economic factors influence access to healthcare services in urban, in urban versus rural areas, and what needs experience? So influence is synonymous with what? Impact. Lived experience. So this is quantitative, qualitative. So this question combines statistical analysis, which is this, with qualitative insight into personal experience, which is this. So this is what? A mixed method question. So now go also look at another. What are the effects of healthcare policy changes on quality of effect and impact and influence? Right? So measurable impact of policy change is what? Quantitative. Now, and how do communities perceive and respond to it? So you see this passive, that's symptom. So it's going to be what? Qualitative. So this is going to be a mixed method approach because it contains both quantitative and what? Qualitative research questions. Now, lastly, so how effective are community health interventions in reducing obesity rates? Effective in reducing obesity rates, which is numerical, and what are the perspective of parents and educators in the, so you see that what it contains what? Quantitative effectiveness, which is related to what? Which is related to what? Quantitative studies and also qualitative feedback from the stakeholder perspective here. So also, in addition, we have what are the differences in health outcome for patients enrolled in telehealth program versus traditional inpatient visit, and how do patients perceive the quality of, so this is the same thing. Differences is relationship, is more on relationship, right? So it's comparing our health outcomes, which is going to deal with. So for you to compare health outcomes, you need what? Quantitative data, right? So, and also understanding patient perspective. So beautifully, that is it. So now let's look at so don't worry, by the next section, right, we're going to look at how to formulate our research question using diverse frameworks. So we have a lot of frameworks. We have the SPIDER, we have the PEO, we have the PICO framework, and we have the PCC framework. Now, it means that with the knowledge we've gotten from here, we will now need to know which framework is going to be suitable for which particular design, because so many of us out there need to understand that for you to do, let's say you're doing your PhD and you're doing your systematic review. So one question that you might be asked is, what type of systematic review are you doing? Are you doing a qualitative systematic review, a quantitative, or a mixed method systematic review? So these things are very important to do what? To understand. So now let's look at our practice questions here. Okay, well, so the kid here has already, answered some of these questions, couple of our questions here. We have a couple of questions already that we've put out here, which is what are the effects of implementing a mindful-based, stress program, stress mindful-based stress reduction program on anxiety levels among health. So we already have effect here. So what does it belong to? So this is an assignment for you. So already marked in red, positivism. Okay, again, how do nurses perceive their roles in providing care for terminally ill patients in hospital or in hospital settings? So this is going to be hospital setting. So this is which of them? So is it going to be positivism, or is it going to be interpretivism, or is it going to be criticalism? So you gotta make that decision. So we also have another question: what are the barriers and facilitators to accessing preventive health care services among low-income families, and how do this describe their experience and others? So you've got to answer, which paradigm does this one belong to? Does it belong to positivism? Does it belong to interpretivism, which is qualitative, or criticalism? So the last one before we go, is there a statistical difference in recovery rates between patients receiving standard physical therapy and those receiving new experimental therapy for post-surgery rehabilitation? So these are just another question. So here now, this is comparison, right? This is like a particular intervention, right? So we want to know between standard therapy and a new experiment. So experiment, right? So that is clear for you to make the choice. So thank you very much for your session. It was really, really very great to have you guys here in this session, right? It was a really very fantastic session. So looking forward to our next session, where we'll talk about how to formulate a proper research question as a baby, and at the end of the day, even a baby, an infant, can be able to formulate a research question. Most times, we've got PhD students, trying to publish, and they find it very difficult because they don't have the right research question, they're using the wrong methodology, they're using the wrong approach. And this session is usually really very, very important for those of us that are actually in not just doing a PhD, maybe you're doing you're writing your manuscript, or you're trying to do you work on your project or your thesis? It doesn't matter where you find yourself, right? You need to understand your paradigm, and your paradigm is going to really shape your thoughts for your what? For your systematic review. So before we end the session, I'm just going to have a run through of what we've talked about, right? So I started by introducing myself. We talked about the fundamentals of research paradigm and introduction to systematic reviews. And so we looked at systematic review, we looked at the hierarchy of evidence, talked about the importance of systematic review, we looked at the differences between systematic review and traditional review. We looked at the research paradigm, we looked at the major research paradigms in the relationship between research paradigm and methodologies. Then we also beautifully looked at the questions, which we can't really wait to start. I'm sure that we really want to start, working on our systematic reviews. And that really can't wait to be there. Definitely, you will definitely get there. And we look at practice questions, right? So we had our young baby. Is that an old baby? I doubt there's nothing like that. So we had our baby who introduced us to systematic review. And we explain systematic review in the very simplest of its forms. They can actually have a bag full of boxes, and that is why we call it a bag full of boxes, right? So just very simple. And we say the systematic review is just about collecting research from several studies. So if we want to look at an example, right? So you can actually go up online. Let's say you go to PubMed, for example. You go to such say for example PubMed, right? So you just insert the keyword systematic review. So you're going to get loads of papers. Let's say for example, we just filter for free text. So we just want to see something we can use. Let's look for. So I just click any random study, open it. Now, so this is a systematic review, right? So this is an example of a systematic review. So if you look at this systematic review, right, you see that in the methodology here, this clearly stated the guidelines that was followed. So this is just what I talked about, right? So when the reviewer, before this article was published, now before this article was published, right? All the reviewer had to do was just to look at this. So the next thing the reviewer is going to do when this manuscript was submitted is to open this. Then they check, identify as a systematic review. Did he identify? They will check the study, they check the article immediately. They'll check. Did he identify? Yes, he did. It's clear in the title, right? Good. And the next thing they're going to do, this is to tell you how the judgment is being made for a systematic review. I just want to explain it in a simple way. Now, abstract, was this stated? Is that there? Yes, the abstract is there. Did you describe the rationale? Yes. Was there an explicit statement of objective? Yes. Is there an execution criteria? So it means that once, if I pick up this topic, let's say, for example, somebody picks up this topic, right, and starts working on it, it is more likely for me, and I follow this same eligibility criteria that was put out here in the methodology, right? So it means that I am going to get the same result and conclusion just like this person's, right? So this is just the basic form of explaining it. So also we also explained what the hierarchy of evidence means. So where we said that that this is what your doctor is talking about, your experts or whoever it is, editorials, letter to editors, right? That they are the base of the pyramid. When we want to judge, let's say for example, we want to judge if paracetamol is going to reduce symptoms of headache, for example, we are going to 99% believe a systematic review over this, right? Because of what? This is has more quality because it has pulled evidence across all these studies, right? To have it. So this is the second step. So the baby is climbing, climbs to believe this, next is going to believe this, it's going to believe this, going to believe it. So we have systematic reviews and meta-analysis here, right? So if you go out online for again and search, let's say you go online and search hierarchy, you search here hierarchy of evidence in research, right? So this is the pyramid, right? So this is the hierarchy. So you're going to see diverse types of what pyramid. So it's just all about what it's just all about the relevance we give to what to the quality of evidence. So this is just like a step, it's still the same thing, right? So when you look at it, find out what background information, case control. So this is just what it is. So systematic reviews are at the what at the top. So that is it. So you can actually look it up and that's it. So this is just what it is. So also again, to talk about the importance of systematic review, which I summarized very decently. I said I told you the need why you should be doing your systematic review now, right? So you need to be performing a lot of systematic review. So my team and I, we've conducted numerous systematic reviews. I've written, I think we've conducted since for the past 4 years that we've written over 150 systematic review dissertations. So it has been up and doing, right? In my team, writing a lot of systematic review manuscript, writing a lot, and then getting some published, and also doing a lot of research. So we've worked on a lot of critical appraisal, we've done a lot of screening, and this is what you need to be doing because practice is going to make you really perfect, right? So I think we need to really leverage that strength, do what we're supposed to do. Once you do what you're supposed to do as a PhD student, definitely you're going to get there. But that's just the only way you're going to get the information that you need, right? At the end of the day, you start informing practice. And your systematic review conclusions are very, very important. So we talked about the tools, which I explained. Don't worry, we're going to explain in details in our future sessions. And also, we try to differentiate between the systematic review and the traditional literature review, where I looked at several methodologies, explained them in details. I also talked about how the literature review of a traditional study looks like. Because when most of us here as an undergraduate, it is that same undergraduate dissertation that you're working or undergraduate project that you write usually in your chapter 2. That is your traditional literature review, where you come up with any type of heading, you choose any type of article you feel like. That is what the traditional literature review is. But in a systematic review, we follow what a checklist. We follow a given step. We don't just do anything we want to do. We follow what is in the checklist, right? Because that is what the reviewer is going to use to judge you. Then the baby welcomed us fantastically into what research paradigm. And we understood research paradigm as how we shape our thoughts before choosing our research question, where we said that for you to start your research question, or for you to start formulating your research question, you need to know the type of what you need to know the paradigm where you're relying on, because already we understood that the research systematic review is divided. You can have a qualitative systematic review, you can have a quantitative and mixed method, and each of the systematic review are all research questions. So that means you need to inform yourself of the right paradigm before you do what you choose your what before you start writing your methodology. So we said that we have 3 major paradigms that we use, which is positivism, critical realism, and interpretivism. Which we explain the positivism to be related to quantitative studies. We explain the interpretivism to be related to qualitative, which deals with stuff like case studies. You have narrative design, any study that uses interview, focus group discussion, right? That is for interpretivism. Whereas critical realism is more like a combination of both. Then we use this boy to explain that, of him counting glasses or counting balls, that he's going to tell the friend that, yes, I found 12 balls there, right? And that's a very good grade fast. So he's like, well, that ball is what it is. It is what it is. And this is what I can see. Compared to children that were being entertained with stories, and that's how they gain their experience. And maybe tomorrow they formulate their research question about, let's say they are formulating their research question on cervical cancer experiences or something, right? It's going to be based more on the information that they heard from the what from from the woman or the old woman who is talking to them. Then also we talk about critical realism as a combination of both, where we talk about this guy who is counting the balls and also, you know, being listening to stories in the background to make his judgment. And also we talk about interception between paradigms where we say positivism is quantitative, which is cross-sectional studies, experiment, cohort, any type of study that uses numbers, and interpretivism for qualitative, critical theory for mixed method. Then the baby also welcomed us to type of research questions, which we explained here. The various measurable questions are for positivism, and the qualitative questions that talks about experiences are for interpretivism, and also the ones that have the mix, both combination of both, are for critical realism. So we also set out our practice questions, and that was how we got everything running. So thank you very much for your time. See you guys in our next session. Thank you, and have a nice time. Thank you very much.